In this video, we're going to be talking about fundus photography and what it looks like to have a picture taken in the back of your eyes. So, what is color fundus photography? A lot of times we use colored fundus photography, fundus being the back, referring to the back of the eye known as your retina, because in the human body there are actually a couple of different fundus locations, but for the purpose of this video, we're going to be talking about the retina in the back of the eyeball. By definition, color fundus retinal photography uses a fundus camera to record color images of the condition of the interior surface of the eye in order to document the presence of disorders and monitor their change over time. A fundus camera is a specialized low-power microscope with an attached camera designed to photograph the interior surface of the eye, including the retina, retinal vasculature, optic disc, macula, and posterior pole. The retina is imaged to document conditions such as diabetic retinopathy, age-related macular degeneration, macular edema, and retinal detachment. So we use the fundus camera or the fundus photography instruments to monitor conditions in the back of the eyeball and observe how they change over time, whether we're watching somebody with glaucoma, macular degeneration, diabetic retinopathy, retinal detachments, holes, tears, you name it. The cameras help us to document and track what's going on. So in a few moments, you're actually going to see what the back of my eyes look like. This is a fundus photo of the back of my eyeballs that we took in October of 2022 with the instrument that we use here in our office. Right now we use the Maestro. It's pretty cool because this instrument used to be spread out over multiple instruments, like you used to have a fundus camera, an OCT, exterior photography camera device, but now kind of all combined in one to make it very handy for us to use. So now I'm going to put up the picture to show you what my retinas look like. We're going to start with my right retina. Okay, what you're seeing here is my right retina. Looks kind of interesting and strange and orangish and odd, right? Well, I'm going to walk through some of the anatomy with you in just a few moments of what things are and what they look like and what is where. So the orange donut's probably going to be the first thing that sticks out to you. That's called the optic nerve. That is a direct connection to your brain to help you process and see the world in front of you. Coming out of the optic nerve are blood vessels, veins, and arteries that span the entire reaches of the retina, and the ones that you see is called the retinal vasculature, specifically retinal arcades. Think of like an old arcade that you used to go to a long time ago, or even most recently where you have literally one machine lined up to another machine, lined up to another machine, lined up to another machine. That's why we call them arcades, is because you can actually like see breaks in the vasculature for how things are kind of spread out and supplies oxygen to the entire eyeball. So the veins and arteries span the entire reach of the retina. You also see obviously the orange color part of the picture called the retina. That it actually goes further beyond that, but this is just what we refer to as the posterior pole, the entire image here. And then you'll see the darkened portion in the middle of the retina called the macula. This is actually your high definition viewing vision. It's actually where you're going to get your best kind of vision from. What you see when you drive, when you read, when you get on the computer, when you're on your phone, when you stitch, when you crochet. Things of this nature are what you use the macula for, which is where we watch for macular degeneration. And the optic nerve is where we watch for glaucoma changes. That's what my right retina looks like. Now I'm going to show you what the left retina looks like. It's almost going to look like a reversed mirror image. So now you're going to see the left retina, and that you'll see the same structures and same anatomical features, it's just in a different position opposite of the right retina. So the optic nerve, blood vessels coming out of the optic nerve, the macula, the retina, the retinal arcades, retinal vasculature, all of that is the left retina and what you see in the back of my eyes. But these, by definition, are fundus photos, which is what we use a lot of times to monitor conditions of health changes, concerns, diabetic retinopathy, glaucoma, macular degeneration, bleeding in the back of the eyeball, blood in the retina, retinal detachments, anything of that nature is what we like to use fundus photography for. And there's a whole bunch of other things you can use fundus photography for, such as fluorescein angiography, which means that this is done in certain places that you actually would have the patient be injected by the appropriate healthcare staff with some fluorescein staining dye that would travel up to the retina. And if there's any leakages or any holes in the blood vessels, you would wait probably a minute or two and then take the picture with a special filter in the fundus photography unit that would actually highlight those areas of leakage. But the technology is becoming so much more advanced that we can map the position of the blood vessels with different instrumentation we'll talk later on this channel about. So when you kind of get right and left lined up with one another, this is as if I'm staring directly at you. This is what my retinas look like, with the right retina, the optic nerve, looking a little bit as if you're viewing it. It should be to your right, kind of towards where my nose is a little bit. And the left optic nerve being a little bit to the left, kind of towards where my nose is. But that's the position of what the anatomical structure of the human eyes look like. And there's a lot of conditions that we see with this. We can even see things like retinitis pigmentosa, macular degeneration, diabetic retinopathy, even a bunch of unusual conditions like Best disease or Coates or things of that nature. But that is what we like to refer to and discuss when we talk about fundus photography and how beneficial and useful and important it is in our examination processes. Now, to get better fundus photos, sometimes we do like to dilate certain patients, meaning we put the dilation drops into the eyes to open the pupil up, because the light, when it's emitted from the camera to the retina, has to pass through that pupil. So if the pupil is really incredibly small, we're not going to be able to get that great of images. Or if there's a super dense cataract or anything like that that could be blocking the light image from passing effectively to the retina, we sometimes like to dilate patients' eyes in order to expand the aperture, open the pupil up a little bit more to get better image quality and to actually see what's going on inside the retina. And it helps us to look at the peripheral retina, which actually goes beyond the extent of the fundus photos you currently see before you, which is important because we like to look for things out there, whether it's blood or retinal detachments or other conditions that may be causing visual disturbances in the far reaches of your peripheral retina. It's extremely important to have this checked by an eye care professional. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for more notifications. I'm Dr. Bryce Heffington, and we'll see you next time.